You can hear him snorting.
Yeah. He is a snort hog.
Oh,
New research provides evidence left-wing authoritarianism is a valid concept, predicts important real-world phenomena, including restrictive communication norms and dogmatism. The findings
here, by the way.
Okay, the findings published in Frontiers in Psychology are based on data collected from more than 8,000 U.S. residents, more than 60,000 individuals around the world. So authoritarianism bad, but left-wing authoritarianism certainly on the rise, and you can develop a way to measure it. It was adapted from the right-wing authoritarianism scale, which I didn't know existed, but that's also fun. It is something that we can definitely get into, or we could bring Nicole in right now.
Well, let's talk about, while we're bringing in Nicole, let's talk about right-wing authoritarianism while she's here. So could she hear us?
We could all be right-wing authoritarians together?
Yeah.
Okay.
What do you say, Nicole? You want to bring right-wing authoritarians together? You know what I'm saying?
Apparently I'm a right-wing conspiracy theorist already, so let's put authoritarian on there as well.
Yeah. Well, I've been left-wing most of my whatever the fuck that means life. And now that I'm hanging out with you guys, like, right, when I was hanging out with the COVID people at those events at Defeat the Mandates, I've also
became right-wing.
Right-winger. I become a Trump sympathist or sympathizer or yeah. So, I mean, but, oh, well, I guess I'm in a cool club. How you doing?
I've been doing pretty good. It's been a little crazy lately. The last year has been like kind of a shit show with what we've uncovered and what we've been dealing with.
Mm-hmm.
So I sent you that article and you saw that Twitter battle go down on with the Vice News and everything like that. So to give everyone a little bit of context, we've been dealing with these terrorist groups, and we use the word terrorist group because that's literally what the police told us this was stochastic terrorism. And so we've been dealing with Team Halo, which is a UN-sanctioned group. They were created by the UN in order to promote the vaccine and improve vaccine confidence. And so they got all these doctors and scientists, nurses, and stuff like that, and put them on TikTok, gave them verified ticks, verified accounts, and gave them preferential algorithm treatments. And then they proceeded to attack anyone that went against the official COVID narrative and try to get them delicensed. And so we've uncovered that they went after Mary Bowden. They went after several other doctors. They were instrumental in getting Dr. Malone and Peter McCullough off of Twitter because they'll go and attack your counts. I'm like, yeah, I'm an anti-vax superstar. And I harass real nurses who are trying to debunk my lies. I can't. I laugh every time.
So this is Vice. You got Vice on your ass. That's kind of cool. I mean,
Well,
I had the Business Insider. I haven't gotten to Vice yet. They got you right at the top of the smear chain.
Oh, well, this is my second Vice article because apparently I was there storming the Capitol on January 6th. And I'm like, actually, I was talking with the president about negligent treatment of patients in the hospital, but that's in a totally different location. So whatever. But yeah, they did this hit piece on me. But really, it did nothing but bring more people to American frontline nurses who needed help, because Vice reaches an audience that is, more diverse because they do sports, they do entertainment, things like that. So that article got out there and reached people where our censorship stops us from reaching those people. So we had an influx of thousands of people coming to us that were vaccine injured, those that were suffering long-term negative health consequences from remdesivir in the hospitals, those who had lost family, those who are suffering mental health issues because of what is going on with the vaccines, people who have lost their jobs. And so we just got slammed with all of these people that needed help. And we were getting them into the support groups that they needed. We were getting them sent to the telehealth services that they needed, doctors that would actually listen to them. So really, it didn't go the way Vice thought it would. And then the cavalry arrived. And everyone's like, she helped me. She's been saving lives. What are you doing? She's been on the front lines. I trust her before I trust anybody else. And ultimately, how this all started was there's this group called Team Halo, kind of like I mentioned before, and they've been attacking people and trying to get them delicensed. And I've been dealing with this psychopath named Tyler Cuck, who's Canadian, and he works in Washington as a nurse practitioner.
What's his name?
Tyler Cuck, Kuhk.
No, I don't want to know what his title, Tyler, is.
Oh, his handle, That Sassy NP. He's on TikTok, Instagram.
He's a cuck.
Right. He was deplatformed from Twitter for hate speech prior to Musk buying it out. And then there's who's the other one? Josephine Kratt, who calls herself Jess 2019 on TikTok, Twitter, Instagram, who's completely lying about her identity. She's she lives in Michigan. Her name's Josephine Kratt, but yet she says that her name's Jessica Anderson and she's from Ohio. And I'm like, that's actually fraud. So then we had, their entire team, once you start digging into them, they've got a doctor named Muhammad Penwar, and he's not even licensed anywhere in the United States to practice medicine, but has been giving medical advice on the internet. He's the one that's been battling Mary Bowden, and they had another doctor who wasn't even a doctor. He just stole the identity of a doctor named Pax, P-A-X. He's under investigation now for fraud and felony charges. They had another one, it's Muscles in Nursing. He has been disciplined by several state boards for drug abuse. And I'm like, these are your people that are supposed to be instilling confidence. And then you come after me, who has literally done nothing but humanitarian work.
But
so
do you think it's useful idiots? Or you think it's more about somebody with sense and getting paid?
They're useful idiots. Well, we know that we know several of them are making money off their TikToks because they have Amazon affiliates. Josephine, who goes by Jess 2019, she's with the Health Influencer Council, and she has paid TikToks with branded partnership labels to promote the vaccine. So they are making money off of their influencer status.
Steve, you got any questions? Oh, the nurse assistant's here.
My shirt is right.
Who's this?
This is, come here, Isla. Is this what you're wearing today, baby?
Aw.
Double layer pajamas?
Yeah.
Heck yeah.
Can you wave? Can you go head upstairs
Hello.
to Dad?
Hey, kiddo.
Daylight savings time has messed with the entire schedule. Oh, and then let's talk about the group Shots Heard Around the World. That's an even worse group. But they're both connected. This pediatrician, I guess, who got pissed off some anti-vaxxers, they slammed his social media and stuff like this several years ago. So he created this organization called Shots Heard Around the World. And what they do is they have a Facebook group where they target individuals. And I've been targeted. Mary Bowden's been targeted. Several doctors have been targeted. And they go and they report your license. And they just swarm your licensing board. So I had thousands of phone calls to the Nevada State Board of Nursing, to the point where I just surrendered my license because we couldn't get any work done. And it was just absurd.
All right, wait a second. I want to understand that completely. What do you mean you surrendered your license?
I had to surrender my nursing license because they were piling up complaints against my license. And the issue is with any state board, doesn't matter if it's nursing or doctors, they will investigate any complaint. And for example, there was a complaint against a doctor, and it was a Post-it note stuck to the front door of his board. And that was the complaint filed. So they said that I was telling people I was writing prescriptions for ivermectin. That was one. That one's on the internet. I'm like, if you read the Vice article, I falsified a medical record. And I'm like, I wasn't even working as a nurse. How did I have access to anyone's medical record that, and they're digital platform. I mean, it's just they're banking on the fact that nobody understands process flows in healthcare. So they were just racking up the complaints, and I was already $20,000 deep into attorney fees fighting this. And I said, this is called lawfare. This is how they operate. They try and bury you in complaints so you can't fight back. So I said, let's surrender the license, and then they can't do anything. And then let's get everyone aware of these hate groups. And then in the background, I can iron all of this out. But Pasta, it was actually so bad that I was getting death threats. People were stalking my house. They were threatening to rape and murder my children. My husband has had to switch jobs like 3 times in order to stay on a schedule where he can be home at night every single night with us in case that there's a safety concern. I had to legally change my name under ex parte motion so that way we could travel around freely without getting stalked, because we had people stalking us at our events. We had to stop advertising every time we were going somewhere. In Puerto Rico, they called in a bomb threat at one of the places that we were at, and we had to divert and go to a church and teach everyone about early intervention. I mean, it was really, really bad. Like, people don't understand the extent of the stalking and the cyber stalking. They posted my address up on forums. Yeah. They were stalking my nursing license. I mean, I wonder, say I don't have an easy, actually I do. I think I have an easy access right here. The, the things that were mailed to me. Say hi to the kids. We'll see you soon. # Team Halo. # delicense the quacks.
Put that up really quick so we can see that.
So this is that sassy MP. So somebody took a screenshot of the video and sent it to me.
Say hi to your kids. We'll be seeing you soon. Holy shit, man.
Here's another one. This is the real estate photo of my house. We bought our house, and then there's little tombstones that say rest in peace, Mike and Isla, on the front yard. And let's see. So there's that. I mean, are there a couple others? Those are just the ones that are like there, that were at easy like grips and stuff like that. But I filed a police report, and then that sassy NP dude, Tyler, gets the police report, gets an attorney. He starts crowdfunding, and so he can afford an attorney. And the attorney it states that it's a misdemeanor to file a false police report. And I'm like, this isn't a false police report when I have like these pictures that were mailed to me. So it's just a little ridiculous. Like, and the interesting part about this is that they only target women. They only target women who
does this particular group or these?
Mm-hmm.
Yeah. Okay.
Yeah. It's always women. They always have children. Several of them that I talked with, one had to completely move states. She had to completely quit her job and move states because she was getting stalked at her house in Massachusetts. One nurse committed suicide. This is when we really found out that it was as bad as it was, that I'm just like, I can totally understand that, because I ended up having to go into therapy and put on antidepressants in order to manage the psychological stress of dealing with this. I mean, like I said, it's bad. They have the organization Shots Heard Around the World. They have an actual Facebook group where they put, you can actually report a target on their website if you go to shotsheard.org. And these are healthcare professionals. We're talking doctors, nurses. There's also Immunized Nevada is in that group. And you can report an attack. So this is Team Halo. And several of them were taken down because they lied about their credentialing. So it's just ridiculous. It seems to be the biggest issue is the American doctors. Go to the other direction. That's where you're going to see most of the hate group part. Let's see if we can see Panwar, if he's still on there.
There's Dr. Karen Tang. We
haven't had some issues with her, but not everyone. Dr. Rubin seems to mind his own business, Bowtie Doc. Mm-hmm. Which is fine. Hey, say whatever you want. It's a free country. It's when you're starting to attack people. Dr. Beach Gem was just in the ER. She's an ER doctor that was in the ER having problems breathing and couldn't figure out why. There you go. There's Dr. Panwar. Click on his Instagram. Let's see if it's still up. He took his Instagram and his Twitter down once we found out he wasn't a licensed physician.
Not available.
Yep.
Not available.
Well, he does have an MD from a university in Qatar, and then he did his residency in Ohio. But he's on a New York website saying he's on a fellowship. But when Mary Bowden called that hospital, they're like, he's not there. He's not part of our fellowship program. And so then everyone started digging. He's not a licensed practicing physician in any of the 50 states or U.S. territories.
How cute. Here it is. Shots heard around the world. Steve, you got to like that. That's good marketing right there. Shots heard around the world.
It is. It calls to a bygone era of simpler times where Babe Ruth could smoke Cuban cigars, then go bat for the New York Yankees. Let's go ahead and get some apple pie and a nice soda pop and inject you with an experimental mRNA product, boys and girls. I feel like the little background music is making the show.
I know. I'm telling my husband to come.
Even better.
He's playing. You can't see it. We have baby chickens over here, and he's playing the piano for the baby chickens.
That's awesome.
Here, let me turn it off real quick.
No, it's fantastic.
Hey,
I just want to do like old timey movie reel voice.
Chickens later, okay?
Aww.
He comes in here and plays his mini piano for the chickens.
Dude, no, that was actually hilarious, especially in context with the shots heard around the world nonsense marketing. It really does. It gives you a real feel of what they're all about. So couldn't have been more perfect.
Yeah, so you can report an attack on shots heard around the world and just be like, hey, this person's talking anti-vax or anti-science, and then they will go and get you deplatformed.
Yeah.
So this is the good old Vice News. Hey guys, don't give your kids ivermectin, even though it's like the safest drug on the market. And it's actually literally prescribed to children all the time, especially in Mexico because of the contaminated water. So I don't even understand what the issue is. I even took it as a child.
I always have a lot of it. So go ahead, Steve.
What you have to do, especially when you're writing under a fake emergency use authorization, still you're doing
3 years
that.
later.
When your whole part of your whole scam is kept held up by the fact that these products are the only products and all other products are to be refuted entirely unless we specifically tell you they're okay. In the first place, they can't make the money off of ivermectin that they can off of any of the other products. It's a non-starter for them. But it also flies in the face that there were no other treatments available for this thing, that there's no other protocols that people can do. Once you accept the fact that this is something that you could take in conjunction with other things, you've opened the door to, well, there's no need for the emergency use. Why are they doing this? What's really... so it's a kind of a linchpin for not only further investigation, but for their house of cards on half of this to fall apart.
Which, by the way, too, as well, we're going to be bringing in Tim Truth eventually coming up soon to talk about his studies he showed on ivermectin. Have you seen any studies on ivermectin that show if you take it as a prophylactic and you take too much of it, it can mess with your reproduction system?
No. I mean, if that were the case, all of like Africa and India would be sterilized because they're the number one users of that drug because of the poor water quality. Like, I mean, honestly, people take it prophylactically there just to prevent like river blindness and other, parasites that they get because of the poor. I mean, if you've ever been to the Ganges River, that's the most polluted water source in the world.
Yeah. No. I mean, I've heard a lot of good things about it. What are the negative things you've heard about it? Like where you would say, okay, because the one thing I don't take it as a prophylactic. I never suggested taking it as a prophylactic. I've always suggested it, and I've given it to my friends for Christmas for years. If you feel sick, I did. I go. You know me. I go to Latin America, so I go pick it up for. I got Brazil ivermectin. I got Colombian ivermectin. I got Mexican ivermectin. I got ivermectin from Nicaragua, from Peru. What's up?
Because you can
buddy?
buy it over the counter, like Tylenol.
And it's cheap, like as can be. It's like ridiculously cheap. But honestly, Nicole, I've told people when you're sick, if you feel sick, then take it. I've never really told people to take it as a prophylactic so they don't get sick. Can you give me some potential lookouts or warnings or something we should be aware of when it comes to ivermectin that we should factor into the point of maybe not taking it so much, or you think it's a go for gold?
I mean, it's a go for gold, with the exception of a couple things. Is that number one, if you are using the FLCCC weight-based protocol, once you get up to about 300 pounds, you're going to start having issues with the blurry vision. And that can be a safety concern if you're getting up in the middle of the night to use a restroom, if you have to drive a vehicle, or if you're walking. Hey, out, buddy. The other thing is that it can cause diarrhea because it does work on the GI tract. It's not excreted through the kidneys. It's all through the GI tract, like 98% of it. So some people will get a hold of us and they'll be completely distressed because they saw some weird stuff come out. And I'm like, well, you eat fruit, vegetables from Mexico, you eat sushi, fish, stuff like that. So it's going to happen. Like, most people have parasites. They just don't realize that they have it because they assume that a parasitic worm infection is literally like the really bad ones that you see from South America, where it's like literally like worms coming out of your rectum. But liver flukes are a huge issue. They sit there dormant in your liver forever. And then all of a sudden, like, all this stuff just comes out and you're like, what is that? And I'm like, we try and warn people, don't be surprised that weird stuff comes out of your body after taking this if you've never taken a dewormer before.
Yeah. It makes, I think, was it Tim James, right, Steve? Go get those hydrocolon therapy. Get that shit out of your system. We got to be careful with the dioxins. That's in all our food here in the United States. Everybody's addicted to fast food. It's the worst food in the world. So when you start getting that treatment, you can't be surprised, especially if a lot of people haven't done it their whole lives. Like, you know what I'm saying? Like, I never did that up until a couple years ago. And then I was like, my body was going through some shit. And people were like, yeah, stuff's been in your body for quite some time. It's coming out. Don't freak out. Let it run its course and stuff. Steve, do you want to talk about anything in particular? Because I want to ask a little bit more. I want to dive into like where we are now. We do have this article, and I don't know if you brought this or Shelly brought this, but the state of COVID right now is got me a little bit kind of crazy. It's like I thought we already know now. We're still at emergency use authorization. If you just simply look at the VAERS, if you look at the VAERS numbers alone, there's more deaths, more illnesses, more reactions, more adverse effect than any vaccine in the history of vaccines from this vaccine. Here we have a Dem bill that would force parents to undergo vaccine education session before they can attempt their kids, before they can exempt their kids from mandates. Now, I would say, hey, maybe we should have doctors do a little education on vaccines. For what I understand is that they might spend a day in medical school on vaccines, a day, if not a half a day. What are your thoughts on where we are today? I mean, can you still believe we're still going through this shit and fighting this fight to get people to understand what this vaccine was all about?
Yeah, I'm not, like, honestly, at what point in time do we just say, okay, we're kind of done with this? But the fact that they're recommending it for the pediatric schedule and the adult schedule, they're going to force everyone to get this however way they can. And they're going to start shutting down avenues and taking away rights and things like that in order to keep this cash cow going. That's what it comes down to.
Mommy, look it.
Whoa, baby shark. Kids,
dude, mine are gonna
schedule.
mine are gonna be here in about a week and a half, and that's they're a part of the show when they're here.
Outright, yeah, they were a favorite on screen until like the weird stalker situation. So I completely stopped posting about my kids and things like that. But no, they're going to keep this cash cow going because this is like, do you remember FDR and the New Deal, where he invested a lot of money into public works programs in order to keep the money funneling and to keep jobs and stuff like that? I think this is like that new concept of keeping the money circulating into like a like a Ponzi scheme or something like that, because it's just a shift of wealth from the government into the private sector, which is ultimately Pfizer. Because look, they shot down J&J, they shot down Moderna, and they also were they shot down, I want to say it's the Novavax, which was the COVID and flu combo. They're saying that there's issues with that, but there's absolutely no issues with Pfizer. Absolutely no issues with Pfizer at all. So honestly, I think we're going to see this is the new fight for the rest of our lives. And then it's just opening up the door to new mRNA tech. If you go into the clinicaltrials.gov, I think it's .gov. They have an RSV vaccine that's mRNA tech as well.
Yeah.
So it was really about getting the new tech onto the market because it had failed for a couple decades prior to this.
Yeah, and there's clips of, there's a now fairly famous clip of Fauci from 2019 talking about how they needed to move from the traditional egg-based model to something different and better and more efficient and blah, 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 and but there was no demand for it. The public, they needed some sort of event perhaps that would necessitate this product being released on a large scale, and then that would give them the opportunity to see what really, how it really worked, because they've only had this 10-year period where they've tried to do this thing and failed miserably every time, leaving a wake of corpses behind them.
Yeah, and they don't care about the little people that die because of that. I mean, one of the issues that we're dealing with right now is like, we're not even talking the deaths and the clots and the myocarditis and that. Do you know that we have a ridiculous amount of women coming to us because they cannot get pregnant? And there's key indicators, because nobody's researching this really, is that if you look, because I went through IVF, because we went through a period of infertility 5-6 years ago. So I kind of have familiarity with IVF and all of that reproductive type stuff. That there's a couple ways you can go about it. The first and easiest is using Clomid, and it causes you just to drop more eggs. That prescription has doubled in the number of prescriptions that have been written in the past. So the stock of Clomid and the organization that actually owns the patent for Clomid, its stock is increasing. And the workers on the production floor of these pharmaceutical companies are saying that there's a ridiculous amount of raw material to make Clomid like they have never seen before. And, they filter all of that stuff to us because, there's nurses, there's like workers that follow us in the freedom movement. And they're like, hey, I work here and this is what's going on. So they're cranking out Clomid, a pill that makes you drop more eggs. And the number of prescriptions has shot up drastically from this, according to the fertility nurses and the nurses working in OBGYN. The next indicator is once Clomid, the pill, doesn't work for you, you actually go into IVF. And one of the medications that is predominantly used as a frontline medication for IVF therapy is Leuperon, and it blocks testosterone. It's also a puberty blocker. And if you look at the stock that for the organization or the pharmaceutical company that owns that patent, they have seen a drastic uptick in they have gains that are going beyond 12% gains, consistently in the past year. And I can't remember what company it is that it's not one of the big major names that we know, but I was looking into all of this because we were talking about what the hell are we going to do for these women? So Leuperon is getting prescribed as an indicator that IVF is being used at a rate that it wasn't before. And IVF is ridiculously expensive. So ultimately, I conceived my 2 children naturally after I broke my ankle and they put me on Vicodin. But up until that point, we spent $100,000 on everything because insurance did not pay for it. So there are people that are pulling money out on mortgages, retirements, things like that. And people are telling us that their IVF is failing, that the eggs are good, everything's working. The IVF nurses, because there's 5 major clinics in this country, Vegas, San Francisco, New York, Atlanta, Georgia, and then one in California, another one outside San Francisco. I can't remember. These are the major 5 IVF places that would be your gold standard in the United States. And they are slammed with patients and demand beyond that. And then the third option outside of IVF is to go to India and get your IVF because it's a quarter of the price, and their price has now doubled. And the nurses in India are telling us that. And you can actually find I think it's their dollar amount is called rupees. Okay. I love you. Have fun at school.
Love you, Mama.
Love you. So now in India, it used to be, let's say, $10,000 for IVF and everything, and now it's 20 American dollars. So we've been seeing this, and the IVF nurses are saying that they're having a higher fertility failure rate than before because those top 5 fertility clinics have the best uptake ratio for conceptions. I mean, and this is what we deal with like on a regular basis. Nothing's working fertility wise. We're talking first time people trying to get pregnant and people who have 1 or 2 children and all of a sudden can't get pregnant now. And they're still in a really good, healthy reproductive window.
And the only difference in their
vaccination
makeup is the vaccination. Okay.
Every single one of them has 2 vaccines.
This tracks perfectly with what Amy Kelly was telling us a couple of months ago. If you guys don't remember, Amy Kelly's the woman who's been coordinating all of the data that Naomi Wolf has assembled. She's in charge of that research team over there, looking specifically at recently reproductive systems of men and women. And it has been all bad across the board, not just with women being unable to get pregnant, but being unable to carry to term. There's male sperm count over the last 50 years has plummeted in general, but now it's doing more or less what Signature Bank was doing this morning. It's almost a straight line down. I don't know. Have you talked to people? Because I'm so hesitant when I see people come out with like COVID cure. This, if you took the jab, this will fix you, and blah blah blah. Yeah, all of that screams gimmick to me. But are there any protocols that people can take if they're interested in trying to get this stuff out of their body, or is it damage done?
It depends on the level of damage and whether or not it's integrated into your genome through the nuclear pores and stuff like that. They're like, oh, there's no way it goes. I'm like, dude, if anything can come out of the nucleus, it can go back into the nucleus. I feel like this is biology 101. But people, depending upon the damage seen, so those with clots and myocarditis have better outcomes than those with neurological symptoms. We've noticed that much. And right now we're seeing, we've been recommending nanokinase and serrapeptidase for everyone. Because, I mean, you never know who it's going to work on. We just see that it seems to work better with those that are having clotting and heart issues rather than those with seizures and neuropathy. So nanokinase seems to be working with serrapeptidase on that. And it's just trying to figure things out. It's like, look, we don't have a treatment protocol that's effective for everyone that has Lyme disease. And we know that that was a bioweapon too. So this is going to be a chronic health issue for most people. I mean, some people I'm sure just do just fine. I mean, there are people who don't catch HIV, you know, even though they're drug users. Is what it is. Some people just don't have issues with things. There are people that don't catch Lyme disease from ticks. It just is what it is. But there's a substantial number of people that are having issues. And the fact that everyone just keeps ignoring it means and there's like the whole mental health connection too. When we were in Florida at an event and we went into several hospitals and talked with families and things like that. There was one nurse that was at the event and she was on the brink of committing suicide. She had a plan and everything because she got the shot and she is unable to work. Her quality of life has deteriorated to the point that death is better than living for her. I mean, she was losing her house. She lost her job. She lost custody of her children because she couldn't take care of them because her health had deteriorated. I mean, this is a huge issue, but nobody wants to acknowledge it. They just keep hiding that fact. And now what you see on TikTok, and just 2019 did a TikTok on this, just making fun of people who are vaccine injured. They just make fun of them saying, oh, it's like, and they just blow it off like that.
Yeah, it's it's sick, but it's also, at least to me, it seems like people reflecting their own personal paranoia and projecting their own massive insecurities, at least at that level, about what they've done, if they're going to go as far as to try and attack someone who's been vaccine injured. I think that in the last few months, even with all of the distractions that have been thrown at people, there's been enough time passed and enough distance from you've got to take this or you're an Asian hating, grandma killing misogynist for some reason.
You forgot transphobic.
Right. Well, I think that goes without saying, doesn't it? Isn't that just baked in? Isn't it?
Yeah. Well, less than 40%, I think it's like 33%, have a booster in the United States. And here's the concerning part is that if you have a healthcare provider, a nurse, doctor, nurse practitioner, physician assistant, who doesn't acknowledge that there's vaccine injury, that posts and especially if they have social media and they're posting anti-Republican thing, vaccine injury, anti-ivermectin, anything like that, and they're making fun of people and they're judging people based off of their political affiliation, based off their religious decisions. Ask yourself, would you feel safe with that person? Would you feel safe with that person giving you care? Because if they're going to say that type of stuff on social media, if they're even going to tell you, oh, well, man, hopefully all the Republicans die since they're not the ones getting the vaccine, would you feel safe? And here's the thing. You can put views are my own on your social media and say that it doesn't reflect my employer's opinion, but your employer employed that person who has a definitive hate group that they're targeting. And no one would feel safe. I know I wouldn't feel safe with any nurse that said, oh, well, hopefully your kid doesn't die because they didn't get the vaccine. And you should be approaching the conversation with, compassion, because it goes back to why would I listen to you if you're berating and attacking me? Do you really think that's going to make me come over to your side?
Yeah.
Yeah, it's not.
I want to make sure that I make fun of Republicans all the time, but I also make fun of Democrats all the time. So, I mean,
but here's the thing. You're not in charge of saving somebody's life in an ICU and making decisions where your personal opinion could negatively affect the patient outcome.
And I was going to point that out. It doesn't make a difference. We've witnessed this thing where we were just organizing for another rally. They start excluding people first based upon their political ideology. It's a big no-no. You just know it's a recipe for a cancer itself, and really can clog things up. Do you find
I don't feel like on any level commitment to any part of the two-party illusion should be something that prevents people from getting care. I really don't. I mean, and I think, I think politics is something that happens way downstream from the decision-making level because history and evidence have proven that to be correct. However, were I in a position where I was a carpenter for 25 years. Effectively, the stuff that I built determines how long those people are going to live in that dwelling. You know what I mean? You really do feel responsible for the overall safety or livelihood of people. If you're building a house that them and their children are going to live in, there's a measure of responsibility involved in that.
You would think.
Know what I mean?
You would think.
And I have had clients of all political affiliations. I have had clients that quite literally fired me for a couple of weeks before hiring me back over a lunch break conversation that we were having about the drone program. And all I did was talk about Daniel Hale and what he exposed that set this guy off. And so but it doesn't affect what I'm doing, and it never would. Yeah,
it's probably because you have a moral conscience, but they literally there are TikTok videos where the healthcare professionals are discriminating against people. Did you see the TikTok about the nurses and their ick? Like, it icks me that, you've got 2 different baby mamas in the same rooms and stuff like that. I'm like, don't tell that. And all the nurses got fired. And then there was another one that said that they didn't give Paxlovid to anyone that wore a MAGA hat. And I'm like, and this is all on TikTok. So it's like interesting because it's like, when it came to like Team Halo and shots heard around the world, they literally posted my voter registration status up on and said, see, this is why she doesn't believe in the vaccine, because she's a Republican. And I'm like, actually, I wasn't a Republican until after the last election. I was always nonpartisan, and you can see it in the history of my voter registration. So what's the issue here? And the fact that half of my following was once Democratic and half of my following is a minority, and at least 40% of them already had the COVID vaccine and realized that it's not something that they want to continue doing. How am I discriminating against them, people? So it's really interesting. It's like, yeah, you can have your opinion, but when your opinion negatively affects patient care because your belief system is so strong. I mean, let's turn it into let's say this is after 9/11 and I didn't want to provide care for anyone that had a hijab or anything like that, because, we're going to blanket them all in as they're all Muslim and they're all radical Islamic extremists. It's like the same thing. We can put race and religion into it. Let's like say a white supremacist does not stop being a white supremacist because they punched into the clock at the hospital. Those negative viewpoints that these healthcare professionals have about those that are vaccine injured, about the vaccine and early intervention, they will bring those belief systems into the patient care. I had a situation where a patient, they had COVID. We got them ivermectin, and he started acting really weird. Wasn't forming sentences coherently and cohesively. And I'm like, hey, there is a clotting factor to COVID. And he was in a pretty severe state. I think he may be having what's called a TIA, a trans-ischemic attack, which is kind of like a precursor to a stroke. I might take him to the ER. And they go to the ER and they said, what medications are you on? They're like ivermectin and Cipro, an antibiotic. And they're like, oh, that's the problem. It's the ivermectin. They wouldn't do an MRI. They wouldn't check him for screening. They wouldn't check his clotting factors or a D-dimer or anything like that. And they sent him home. And I'm like looking through his meds. I'm like, hey, I think it might be the Cipro that the doctor gave him because he also had pneumonia. Let's call the doctor back. Let's get a different antibiotic. Sure enough, one of the rare side effects of Cipro is hallucinations. So we stopped the Cipro, started another antibiotic. And imagine somebody with an MD couldn't do that because he brought his negative belief systems and his personal opinion into patient care. And how long would that patient have been on that antibiotic before a different one was prescribed? And my dog's going to bark at me to try and force me to give her a treat.
You have a land seal.
Right. So, I mean, it happens all the time. And so that's why I'm very wary of any healthcare professional on the internet telling people, speaking negatively about any treatment or patient population of any sort, because we've seen it all the time. I mean, in the beginning, how many times did people not get treatment in the ER based off their vaccination status? How many stories have we heard from people personally that stated, oh, well, you should have got the vaccine, and they won't give you monoclonal antibodies. They wouldn't even give you a steroid. They wouldn't even give you a breathing treatment. They just put you out in the hallway and let you suffer. They wouldn't even give you oxygen.
How long have you been now out of did you give up your license in
October? I want to say it was October.
I didn't even know that. It's been a while. Wow. So how was it at first? Was it tough? I remember talking to Dr. Merrick at the time when he was getting forced out of his job, and he had done for 20 something odd years, or maybe close to 30 years. I'm not even sure. And I know he was having a hard time because they weren't letting doctors be doctors, and they were, taking away something from his livelihood, something he had, held so dearly for quite some time. How are you handling it right now? Was it hard at first? And I mean, do you still find it effective in this stage right now? And what do you see yourself doing down the road? Because,
well, I'm in a really interesting situation where all I have to do is fight, go back and counter for my nursing license. So they said, oh, you're writing prescriptions for people to have ivermectin, which is obviously against my scope of practice. And all I have to be like, no, that's not physically possible. The complaint that, oh, you told people you're outside your scope of practice by telling people to give your kids ivermectin. I'm like, well, I was in South America. You have no jurisdiction over what I do in South and Central America. Also, I have a medical director with standing orders for my patient education online. But so I can go back and I can counter all of this stuff. I just never could because they just kept slamming the state board to the point where the phone lines were jammed, the emails were jammed, the fax machine was jammed. All work stopped at the State Board of Nursing. So I actually surrendered my nursing license to help the state board out because I have an MBA. I don't work as a nurse. I haven't since I was fired over the vaccine mandate. So I pivoted and went the other direction with my other degrees and certificates. So I've always made sure that I was diversified for my employment opportunities in case anything should happen. So it didn't really upset me so much as it's an inconvenience because I'm going to let go of that license when I'm ready, not when somebody forces me to. So what we did is we let everything calm down with the state board and I can just go back and counter everything. And that's the plan. And Team Halo thinks that they won because all they see is a surrendered nursing license. And I'm like, what really upset me was me having to change my name to a completely different identity. That's like when I got the paperwork from the judge to change my name because like literally we were being stalked. We had to change like hotels several times at one event in Florida because people were hunting us down. And because they're just deranged, crazy people in this world that are fucking weird. And that part I cried about it. But the rest of it is just like, I'm going to make sure that this doesn't happen to another nurse. What really spurred me to action, I was on the brink of committing suicide because I was in this constant state of fear that my home was going to be raided. They were going to come in and take my children if I attack me. Like when I'm at the grocery store loading my children into the car, you hear that, your kids are buckled up in the car and then someone takes the car and, abducts your children. I was in this constant state of fear, like something like that would happen. I was afraid to take my kids to, their dance practice. I was afraid to take them to soccer practice because what happens if two assailants come? Yeah, I'm a black belt, but I don't think I can manage two assailants as they're grabbing one child and one is keeping me distracted. So, that psychological torment, I can understand why that other nurse committed suicide. When we found out that there was a nurse that committed suicide, that spurred us into action, into going back after these groups and exposing them. So, yes, I did surrender my nursing license in Nevada and I let it expire in Utah. And I'm working with the Utah board right now. I said, can we just leave it expired? Because they're watching it. And I sent them screenshots. I'm like, every day they're posting about whether or not my license is still expired. They're waiting to see what's going to happen. So that way they can come and attack Utah next. And they're like, what? So I had to do this whole write-up about shots heard around the world and Team Halo and send them YouTube videos and stuff like that. And I'm like, this is what they're doing. And so all I have to do is just submit them their evidence that they want and the complaints get dropped. But until Team Halo and shots heard around the world and these people are held accountable for their actions and doxing other healthcare professionals, because here's the issue, is that healthcare professionals, doctors and nurses, especially in the nursing field, the misinformation part says that it must be evidence-based and accepted by the CDC and the FDA and NIH. So it doesn't matter if you show them research, like the FLCCC website is filled with research on how ivermectin works in other countries. You can send them that information. It doesn't matter because it's not accepted by the CDC. So there's that caveat in the whole misinformation memo that came out to all the state boards. But I'm honestly, it negatively affected me in the sense that I was in a nurse practitioner program and I can't finish it because I don't have a nursing license, because my ultimate goal was to open up a low-income clinic for all of the low-income, those that were on Medicare and Medicaid in my hometown, and to do, humanitarian work through that, because we were going to have the nurse practitioners fill that gap with providers that were no longer taking Medicare or Medicaid for low-income and fixed income and elderly and things like that. So ask, these healthcare professionals that are coming after me, you have to ask yourself, how did you help patients by stopping me from opening up a low-income clinic to help these vulnerable patients. Like, I was on the Nursing Practice Act for Nevada, and one thing that I was working on was rewriting the EMS regulation for who can be a flight nurse. And that got completely dropped because I had to drop being on the Practice Act committee. And do you know, just 2 weeks ago, an entire flight team in Reno died?
No.
Care flight died. Maybe if you had let me finish my work, those lives could have been saved by the policy and procedures that we put in place. But you were so fucking focused on ivermectin and this vaccine that you let that entire flight team die. I didn't, because I was trying to stop that and make sure that there was safety and training in place to protect life. They only see what is necessary for them and their self-gratification, and not overall what's better for patients. And that goes back to their own personal narcissism.
What is the percentage wise right now, you think? I know you can't put a percentage wise on it, but as far as people taking the vaccine now or continuing to take boosters, is there a lot of hesitancy in the public right now from what you see as compared to when it first rolled out?
Yeah, we were checking like the country's overall booster rate, and it's like less. I want to say it's 33%. It's definitely under like 40%. And there's only like 5 basic Democratic states that are the most highly boosted at 80 some odd percent. But vaccination rates for that and other vaccines, like the traditional vaccines, are falling everywhere. The flu shot vaccination rate is falling because vaccine confidence has been lost because of the poor handling with all of this. And the fact that you're mandating everything. I mean, it's the most counterintuitive policy I would ever think.
Yeah.
To happen.
What states are the most mandated right now that you've
I know
seen?
I want to say Washington.
Seattle, right? Yeah.
Washington State is the number one.
Yeah.
I want to say Pennsylvania, Maryland, California, I think, because we looked this all up like a couple weeks ago, but they were all Democratic states, we noticed.
I think that they need a defeat the mandates to go to Seattle. That's where we need to go next, because that's where the mandates are just, because we did it in California, right? And you had an amazing speech, by the way. You were on fire, but we did it in California, and we were in the heart of the beast at the time. They had like 8 laws they were trying to push through. I think they did get a few of them pushed through. Some of them got retracted. I also believe that California dropped the COVID-19 vaccine for the children's schedule, I believe, after so much pushback. So I think we got to get to Seattle, Washington next, because I heard the same thing, that they are still the most mandated state out there. And a lot of people don't realize, they think it's over. They don't realize that the mandates are still going, that there are mandates, and they're still pushing this vaccine, and they're pushing it on children. So it's interesting that you mentioned Seattle, that you mentioned Washington right out of the gate, by the way.
It's one of the worst states for medical tyranny.
Yeah. I don't know. I get extra. Okay, Gomez.
There's dogs everywhere.
Right.
She's got a hound. You got a Gomez. Did you see Gomez yet, Nicole?
No, I haven't seen Gomez.
When you first came in? Oh, I thought you saw Gomez. He was up there.
He usually pops in. He might, if he wakes back up during the next, half an hour.
Was that a snore? Was he sleeping?
Oh yeah. Yeah.
Mine knows she can bark at me to throw her treats to make her quiet as soon as I start talking to my screen.
Okay, they got that figured. See, Gomez knows that it's like his time to try and yank the earbuds out of my ear by coming across the whole entire, chair, and then he gets to snort right up into the microphone. It's usually how that goes. Usually, there was Did you see, Nicole? And I want to play this clip while you're here. Former governor of Minnesota, Jesse Ventura, was interviewed by Kim Iverson a few days ago, and Jesse is his brain got kind of saturated before COVID, certainly during. It broke more than it had at any point over getting hit over the head as a professional wrestler, or any sort of stunt he may have done in Hollywood. He was a little bit fried out. The conversation that he had with Kip Iverson, pretty wild. And there's a clip, it's only about a minute, of him responding to a question that I don't know. I just want to see the look on your face. I guess is where I'm headed with this. I really do.
You want to see Nicole's reaction to this?
I know what I looked like when I watched this, and boy, howdy. There we go. Let's run it.
Like I went through the thing. I did a radio show where everybody chastised me for wearing masks. So I said to them, well, let me ask all you anti-mask people. You tell me they don't work, right? That's what I was told. They don't work. I said, well, then you're telling me my mom lied to me. Because my mom was a nurse. And I remember as a child, I went in to visit her at the hospital and she came out of surgery. And I said to her, Mom, what do you wear that mask for? And I was a little kid, so she simplified it. She said, well, I have to wear this because it stops germs. Now, isn't COVID a germ?
Well,
so I
it's a
told
virus.
these it's a germ, though. Oh, you get
Maybe
it?
she meant like large particles, like it's meant
No,
to stop
no,
from
she
like
didn't.
blood and guts
What
and
she meant was
urine
very
getting in your mouth
simple.
from surgery.
And all these people that don't believe masks, I challenge them. The next time you got to go in for surgery, tell them they don't have to wear them because they don't work. And I finally said, look, I believe my mom more than I do you. So I'm going to believe what my mom told me. They stop germs, which means they'll help stop COVID if they're worn correctly. Why do you think doctors and nurses wear them in surgery?
Yeah, they wear them in surgeries because they actually are communicating and talking over someone's opened up body. You can literally actually give a patient like strep or staph like in surgery. So I mean,
are you calling Jesse Ventura's mom a liar?
Well, I mean, she's correct in the sense how she was explaining it to a little child, and I think he took it as gospel up into being an old man without educating himself over it. Well, back then they didn't have Google; they had to use encyclopedias. So obviously, he maybe didn't have an encyclopedia set. But now you can just pick up your phone and figure that stuff out yourself. Now, like I feel like. Does he still put bacon grease on burns? Like, I mean, you still put bacon grease on burns? Like, what are you doing? You putting butter on them? Like, I don't get it. I bet you still use Neosporin past 3 days.
40 years earlier, 50 years earlier, and if Jesse's mom was a nurse, he'd be sitting there telling Kim Iverson, there were people who were anti-leech who were a part of my show. And I said, well, my mom swore by leeches. I mean, that's based on the way that he's acting right there.
Yeah.
It's a 71-year-old man.
The science has changed since then. Like, I mean, so much has changed like during surgery too. I bet you that they use, dissolvable stitches and stuff like that now too. Like, I mean, I think that he wanted to grasp on to the fact, that his mom was a nurse and that gives him some type of authority or something like that. I don't even know what to make of that. Like, yeah, you wear masks in surgery because what happens if you have to cough or sneeze over someone's opened up body? Like, I literally had to sneeze. I did 1 OR rotation and I absolutely hated it. And I had to stand there for hours watching them cut and dissect this guy's neck to get a plaque out. And it's a big deal when you have to sneeze. Okay. It's a big deal when you have to sneeze. So that's what your mask is there for, so you don't have to cough or anything like that. And once you sneeze, the surgical tech has to swap out the doctor's mask. So, I mean, none of that makes any sense. We literally have science at our fingertips, old man. Just go read it. Because if they worked, we would have stopped this pandemic. We would have stopped the pandemic. everyone just wear masks, and then this all would have been done in the 2 weeks to slow the spread. Now that we're 3 years into it.
I wasn't able to track down the exact clip. I have a very, very clear memory of Jesse's conspiracy show that he did 14 years ago or whatever, 15 years ago, where he's flat out saying, my mom lied to me about Santa Claus and the Tooth Fairy, like stuff like that. He's blaming, flat out.
Well, he just threw his mom under the bridge. That was quick.
And then, so, flash forward to when it's necessary to have the exact opposite standpoint. Well, my mom told me that this was the way it was, so it must be true. Are you calling my mom a liar, Kim Iverson? That kind of thing. Bro, see, who is it? Chris, I'm pretty sure Chris from Rain.Rantcast has the clip, or was at least talking about it. But I remember very clearly Jesse going off on all the things on his conspiracy show about all the things that his mom lied to him about. But now it's okay. Now it's okay because his personal misunderstanding of this.
It's okay when it supports the narrative.
Yeah.
People are over here trying to say that the KN95 masks are equivalent to N95 masks here in the United States. And I'm like, those are by China's standards. Do you really trust China's standards? The K stands for Korea. That's where I wouldn't even use those, spray painting.
Well, I don't know what their standards are. I really wouldn't use that kind of analogy to say, hey, you're going to really trust it because it's Chinese. I saw the Indonesian masks or wherever the paper masks were, the ones that say these aren't for COVID, that everybody made you wear for COVID. I've seen video of the factory that they're made in, and it's, a handful of barefoot, sweaty people just grinding it out over sewing machines. There's masks all over the floor, and they just get blown off once before they're thrown into the package and shipped over here. I mean, it's that's not to say that there aren't shoddy American standards for manufacturing too. My God, have you ever been in a building in Las Vegas? Are you kidding me? Dude, these things are built on like chewing gum and duct tape. It's all garbage, it's so, I mean, there's standards are reflective based on what you can get away with. And if your country is allowing you to get away with more, as they do seem to be in a number of Asian and Southeast Asian countries, as far as producing shit for us, I would tend to, just without any inherent racism, be like, well, there's a clear standard of production that is different and lower, and there's nothing necessarily inherently racist about that. They produce everything we have. I mean, every fucking thing. So it's, you have to use those standards across the board. We don't make shit here in this country.
No. Well, that was just like in World War I think it was, or when the Spanish influenza, when Spanish influenza was coming through. And there was an issue getting syringes and other medical supplies because it was all made in Germany. And I'm like, you think we would have learned? Because like when COVID hit, we had this pandemic, everything was made in China and we couldn't get anything during the pandemic because we didn't manufacture our own goods. So it's really interesting.
Yeah,
I would keep repeating the same mistake.
It sounds to me like this is everybody agreeing that we need more localized manufacturing of things. That's what it sounds like. If at all possible. Or I mean, if you're gonna at least try to set your own personal standards for what you want in your home or what you want in or on your body, then at the very least you could support or encourage people who are doing those things. There's a number of people that make clothes in this country. There's a number of people that will maybe have some parts that aren't necessarily manufactured here, but will at least do assembly here and will at least aftermarket and beef up stuff for you to where it's a little bit more compatible. But I mean, there's an international standard for things, and then there's the standards in individual countries that far outweigh that. It's kind of the same thing that we like. Okay, the let's shit on America version of this so we can make pasta happy is with organic food and with food in general. What is allowable, the allowable amount of toxins and cancer causing agents and things that make your balls go away and all of the shit that we put into the food here. We know this, Pasta, you know this firsthand. When you travel outside of the country, the food quality goes way up immediately. Because in other countries, they have much higher standards for what they will allow into their food. It's the exact same thing. It's not, inherently racist. It's just there's an international standard for shit. Sometimes it's met. Sometimes it's in individual countries, it far exceeds the international standard. That's it.
Yeah, the fruit does taste better in Latin America.
Heck yeah, it does.
When I fucking eat it, I'm like, holy shit, this is so good.
I mean, it tastes better when you grow it in your own backyard too.
That's the point I'm trying to get to, is that no matter what, pointing the finger to any country, we have to take it as individuals ourselves. There was a young reporter who was at the Defeat the Mandates in DC. I forgot her name. She wore the hat. You probably met her. She's awesome. But she's really taken on the whole gardening thing, and she's just going with it. And she's like giving advice for like $3. I could buy me a coffee. And she's been doing consulting, and she's been growing food for the last year. And she's like, I hardly even go to the supermarket now for just minimal things. And I think that's what it's really all about, is us taking individual responsibilities for our own health. And that's something that really didn't hear about. Gerald Celente, when he was on our show, used to talk about it. Was like, nobody wants to take responsibility. How about go for a walk? How about eat some friggin' yogurt? How about take your own health into your own hands instead of just saying, hey, give me a pill to make me feel better? And I think that's where we're at across the board. And I don't want to point the finger at any party. I don't want to point the finger at any party. We talk about this. All right, there's a lot more, I think, conservatives or populist right or whatever you want to team sports person talk about that are more into taking care of their own health and not depending on the government. We got that. But let's not forget that tiny President Tiny Hands said this was the greatest achievement he's ever had, was Operation Warp Speed. You know what I'm saying? It came out of Donald Trump's presidency here. So we can't forget that. I think we have to push aside all the bullshit and just put it in our own laps. That's just my personal opinion.
Yeah. And I mean, I definitely, since COVID, I've definitely had a different opinion on everything from food to health. We've made so many changes. Like, we have a Berkey filter now. Like, we do as much organic as we can, because I'm like, oh my gosh, it really creates this like waking up experience. I mean, instead of like taking Benadryl at night to help me sleep, I'm like, you know what? I'm going to try this grounding mat like everyone else is trying, that you put on your mattress pad. And I swear it's made a huge difference. So I got a grounding pad, and then our kids still co-sleep with us because, when they were babies, they co-slept with us, and then it just led into all the safety concerns with the crazy stalkers. So they still sleep with us. And I got to tell you, their rambunctious behavior at night going to bed has completely diminished because of the grounding pad. And so honestly, it's really got me thinking about health overall and taking more of that personal responsibility into health, because I'm like, I don't need to give my kids melatonin to help them sleep at night. The grounding pad worked for the entire family. So yeah, once back to that
grounding pad. Can you
a grounding pad? I thought they were like, "What are you talking about? A grounding pad?" What is a grounding?
What is it?
It's this mattress pad, and what it does is like, how you go earthing or grounding and you put your feet in the grass. It's like this exchange of energy, and I don't know the full concept behind it, but everyone else like raved about it. So it's a pad, and it plugs into. You plug the pad. It's like a really thin sheet type pad. You plug the connector to the pad into the grounding port of your electrical socket. Yeah. And you just lay on it, and it is the deepest sleep I have had in years. Like, the only deepest sleep I've ever had was like exhaustion working like in a refugee camp or something, where you just fall, like you lay down and you go into a mini coma and wake back up. But I noticed like the very first night that the children weren't like bouncing off the walls. Cause nighttime settling your kids down is always an issue. And I just bought mine off Amazon because I live in the middle of nowhere. Just search grounding mattress pad. And I bought it, put it on there, and I noticed instantly the kids settled down. Like that night, I just thought, oh man, we didn't have to fight with the kids to listen and lay down and be quiet, stop doing backflips off the bed, stop jumping. And it's been like that the entire week we've had this. We're going on 2 weeks now with this mattress pad.
That's awesome. I want to check it out.
Yeah, try it. And so it really just brought me into thinking about all like taking this personal responsibility and Ambien if you have a grounding pad.
Steve,
I'm
you
trying
gotta try
to,
that. That's my Christmas gift to you. I mean, a birthday gift. How much are they? Are they pricey?
I bought ours for $99 because it was the one that would fit kind of across all of our bed. But there's cheaper ones, more expensive ones. But I just got the one that was rated the highest and had the best reviews, as in it didn't break. They actually saw like some type of benefit. Because I go off Amazon reviews because I'm new to all this crap. So like, let's see what the other people say. $99, and it was like my kids didn't need melatonin for the time change, because normally we use melatonin to get them back on schedule for the time change. We aren't yelling at them anymore or having to put them in timeout for bouncing off the walls at nighttime. I'm like, this is amazing.
Steve, I'm getting that.
I've slept on copper mattresses, and they've been hella comfortable and stuff like that.
Mm-hmm.
My issue though is that my leg locks up. And I fell 18 feet off a roof. I landed on my feet, but tib, fib, talus, blowout, compound impact fracture, rods, pins, blah, blah, blah. And so after about 3 hours, it just locks up. And I get woken up from that. And so even with the copper mattress, even what I found is that it's the getting back to sleep.
Yeah.
Usually that is difficult. Although again, the couple of times that I slept on a copper mattress, that wasn't necessarily the problem. The problem is that they're like the hella spendy mattresses.
Yeah, it was just $99 for that grounding pad, and they have like grounding pillowcases. They have one where it's like a grounding pad that just goes across the top. That was like $50. I'm like, shoot, if I'm gonna do this, let's cover the whole damn bed. Because obviously I couldn't do a grounding pillowcase because that'd be like a strangulation hazard with my kids. But I don't know. Try it. You never know. I mean, it's better than taking Ambien or Benadryl. And I thought it was. I'm like, grounding. What are you talking about? You can't go outside and play in the grass because there's like a foot of snow. So I was going to try.
By the way, I didn't know you were into making comic videos, and I was laughing hysterically. I had to pay it a couple times. Just want to let you know there's almost 6 inches of snow here in Boca Raton.
Oh, yeah.
There's about so everybody watching the show, if you watch Nicole Sirotek, there's about 6 inches of snow over here. Just want to let you know that. So
okay, but men are poor gauges of any measurement, so it's really probably 4 inches of snow.
That's not true, Nicole. It's not,
no, that's why
the rulers don't lie. The rulers
that's
don't
why
lie.
That's why there aren't too many female carpenters, Nicole. It's because they've been told their whole life that this is 6 inches. So
right, yeah, they do. Shots heard got me deplatformed off my first TikTok account, so that's where that video was, but I'll have to post it again. I think it's on my phone, but that was hilarious.
I was laughing hysterically because I was like, because here's Nicole Sirotek, she's frontline nurse, right? Okay, so I'm gonna she's got something serious to say. What do I got to look into? So this dude's talking about snow. I mean, is that like a lot of snow? Is that enough snow? And then you're like, just over here they have this much snow, and over there they have that much snow on average.
In Panama,
Nicole Sirotek, your friendly nurse.
Oh, well, you know what? I mean, we're excellent gauges on like penis size, like as nurses.
Yeah, but where do you measure? Funny. From the side, or do you go where's the proper place to measure from the bottom part?
It should be from what's called the mons pubis to the actual tip of the pubis. So right where it goes like to at your body outward, and then there's a flaccid length and actual hard length, so shrinkage is real, just like Seinfeld said. But it was just like, it's so funny because like men will be like, when I worked at the VA and we had all the young veterans like coming back from like Afghanistan and stuff like that, and you've got this 27-year-old nurse coming in, and I'm like, don't worry, it takes a lot to impress me, so just drop trowel, let's go. I had a family member who was in an accident, and he has a suprapubic catheter, and they sent him home with like a home health nursing. So they're like, hey, can you come over and like bro, trust me, you ain't got nothing I haven't seen before. I've seen more privates than a general. You're going to have to drop your trousers. I mean, he's ex-Marine too. So, I mean, you know, but yeah, like his suprapubic catheter was all messed up and everything. But yeah, it's so funny. We had this one old man at the nursing home back when I was a new nurse, and he used to act like he couldn't speak English because he was Basque, and it's an indigenous language to this area. And he would be like motioning that there was something wrong with his groin, and he would always get the new girls, and they would like look like, is everything okay? Because you can actually get ulcers down there from like you get really bad yeast infections as an elderly person if you're not keeping things clean. And then he would just sit back like this as he got an erection. I mean, the guy was like 80. And I'm like, damn it, will you stop that? So we had to warn every new employee that he was going to try and get them to touch his penis. Oh yeah. Did you see the video about the cock rings on Thirst Trap Thursdays and how we had to do I had to do a public service announcement not to use the metal cock rings because you'll end up like losing your penis?
No, I did not see that one.
That doesn't sound like any fun. I mean, I'm not here to kink shame, but let's just really.
Well, people don't. They don't realize.
Metal.
They don't realize it's like autoerotic asphyxiation kills a bunch of people every year too because they have no fail safes. They'll do it by themselves. I'm not here to shame you in whatever your sexual behavior is unless you're touching
Just be
children.
careful.
But be careful. So what happened? So when I was a student nurse, I was in the ER as like a student nurse apprentice, and every week, like in Reno, they would come in and there would be one of these rings stuck on someone's penis. They would do what we would call like a hooker and blow bender. They get Viagra, cocaine, whatever, get a prostitute. It was always a situation. It wasn't just like, hey, you know, me and my wife are being exciting today. It was always that situation. So you've got Viagra with a ring stuck on your penis that prevents backflow of the blood into your body. And I'm just like, you know, this is like wrapping a rubber band around your finger, right? And watching it turn blue. And then like, you know, this is literally how we castrate goats, right? We wrap a ligation band around their testicles and they will fall off. Like you're doing the same exact thing. This is how the ranchers castrate their goats.
Yes, and this is facts.
Yeah, and I'm just like,
you had to put the goggles on and get the bolt cutters out. And like, okay,
so that was there was an evolution. There was an evolution to this madness. So I'm like, after so many times of having to call the fire department to get, you know, the clippers out, or we would have to call a tow truck company because they would have bolt cutters on their truck. And it's like, how do you even build that? Like, hey, we had to call the fire department to cut this cock ring off your dick. Like, you know, and so I'm just like, hey, why doesn't someone just go down to Harbor Freight and buy us a bolt cutter? So I'm like, F this. I'm getting tired of waiting on the fire department, tired of waiting on the tow truck company. I went down and for $20, I bought us some bolt cutters. So then we had bolt cutters for a couple weeks. And I'm just like, why do these men keep coming in? Why is this a weekly thing? It's like, damn, we got 4 this week. You know, because I always work the weekends because I went to school Monday through Friday. And so I'm just like, you know, and then I realized they're like, oh, well, they're getting them from the sex shop because we had this sex shop called Susie's down in like the red light district of Reno. And I'm like, can someone just go there and tell them like maybe they should switch to silicone, like a silicone cock ring? Because then that could just easily be removed by anyone. You know, some lubricant, some spit, that thing will slip right off. Even household scissors will get those silicone rings off. And this was like about the time silicone was really becoming big. You know, they had like silicone bakeware and like cupcake liners. It was like really becoming like the alternative to plastic. And so a couple more weeks of these men coming in, coked out of their mind, lick me like a lollipop. And I'm like, bro, we're going to fly you out. You're going to have a vagina now. Like, you know, I mean, like we'd have to send them out to typically Stanford where the vascular surgeon was. That could try and salvage their penis depending upon the ischemic, you know, vascular injury. I mean, sometimes they would come in soon enough and there wouldn't be an issue. There'd just be some like ligation injury to it. Other times it's like, man, you're going to have a vagina now. Like you're going to be peeing into bags because they're going to have to divert your urine stream because they had to chop your penis off.
Morning show talk is beautiful. What happens with the women? Like, so we get the men with the cock rings, and that thing gets too on there.
Well, we've learned a couple of things. We've learned that metal cock rings are probably not a good idea. Not a good idea. may require bolt cutters. Nobody likes that,
Mhm.
you know.
What about
And we've
stones,
also
like ivory,
we
or is that bad, or
Well, you
jade?
know
Like
what? Here's what we have to deal with. So a lot of women will get the Kegel balls in order to like practice Kegel exercises, so that way they don't have like urinary continence. Because that's like, you know, when you cough, laugh, sneeze, jump, they'll have that stress incontinence. So a lot of times we have women, and the Kegel balls will get stuck inside their vagina, and then that's hard to get out.
We've also learned that you may want to employ the buddy system if you enjoy the choke and stroke. Yeah.
You know how many
Yeah.
people like end up just found dead with like a tie around their neck, like in like a hotel?
Yeah. Yeah.
It's
The
just
ones that
ridiculous.
concern
Well,
us the
that's
most are the
women's
ones with
fault.
the red scarf on the door, though. But that's a different.
Yeah.
That's a different show.
Our friend
altogether.
does this whole like comedy about it, like, you know, it's like the women today, you know, choke me, hit me, all that stuff, and it's like you got to get like, you know, this. Can you sign this, please, this release form before we go into the bedroom? You know what I'm saying? You got to make a video, the whole 9 yards. And
Dave Chappelle did that a long time ago too with the sex contract. That was a Chappelle bit. I'm not going to do Brett's jokes, but the alliteration in this particular segment, if you ever get an opportunity to hear him do that bit, I do love me some well-placed alliteration in the middle of a joke, and it's
yeah,
fantastic.
if there's a hole you can put something in, they're gonna put something in it.
Jeez.
Yeah. Well, the trucking industry has proved this over the years, if nothing else. It's just very, very.
How
very
did the
ambitious.
trucking industry?
That's where you get the whole a whole bunch of fake pussies and let's go ahead and turn a watermelon into a fuck toy come from.
Oh yeah, the fleshlights and stuff like that. Have
Oh,
you
yeah,
seen
yeah.
when they try to innervate a cow heart and use that? That never ends
Oh
well
my,
either.
a cow heart.
Because it'll pump and suck, and yeah. Anyway, most people end up electrocuted, and that was the creation of the fleshlight.
All right. I mean, that's a whole podcast in and of itself.
I know.
No, I'm an ICU nurse, and they used to call me down into the ER because I used to lift weights, still lift weights, but I had the smallest, strongest hands. Because if I couldn't extract it out of your rectum, you were getting shipped out.
All right.
You were the
we
last
literally
line
kept
of defense.
We had gloves that would go up to here, and you'd be elbow deep into somebody's rectum. And I'm
The
like,
human claw.
yeah, well, because most people don't understand past 4 or 5 inches inside your rectum, it creates suction. And if you try manually remove it, you can actually tear your entire sigmoid colon, like perforate your bowel, which is a life-threatening emergency. Or it just gets sucked up in there. You know, beer bottles are always beer bottles in the shower. No one accidentally falls on a beer bottle or a shampoo bottle.
You know, here it is. This conversation's making me feel better because I know I'm not that freaking crazy
Freaky-deaky?
anymore.
I was going to say alone.
I was considered. Not that alone. No, I am never heard about any of these stories. This is the first time I've ever heard of putting myself.
Well, you know what? Because we do so much serious stuff. We do so much serious stuff that, like, we decided as American Frontline Nurses, we do Thirst Trap Thursdays. And since 70% of our audience is female, we'd open up with like some like buff dude, like chopping wood or doing something. And then we would do some educational stuff. Like, by the way, don't use cock rings. By the way, don't do this. Like, make sure you have a string to retrieve your Kegel balls. Like, you know, teach people and have something other than like the seriousness of COVID and blah, 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 blah. Yeah, Thirst Trap Thursday.
I can appreciate that. Okay. Absolutely.
Well, most people don't actually know because in sex ed, do they actually teach you that? I used to actually teach a course called adult sex ed, and like people don't understand. They'll put like anything as a lubricant. They'll use like jelly. And I'm like, that's going to cause a raging yeast infection. Like, you can't put sugar. You can't put sugar up there. I'm like, non-flavored, full-fat yogurt is the only household item you can use. Nobody tells you that stuff. And then you end up going septic because you've got this horrible vaginal infection, vaginemia, I guess you can call it. And yeah, or you should really shower before you go and get a Brazilian wax job, men and women, because you can catch a staph infection. And like, there was a time in my hometown where it didn't matter where you were getting your bikini line done from, but there was like, you'd end up with an ingrown hair with a staph infection. And like in your mom pubis, like you can go your whole hand in there. You'd have to pack the wound. And I'm just like, because they'd have to open it up, drain it from the abscess that like started and everything like that. And then I'd get stuck doing wound care, and then they'd be on IV antibiotics at home. And I'm just like, can someone put out a public service announcement to just make sure to wash before you go to your waxing appointment? It's like simple things like that actually prevent healthcare issues, save you healthcare dollars. Shower before you go get a wax job.
Well, I think now everybody knows for certain questions where they can go to. I think our next time that you come on the show, it's going to be a different show. You know what I'm saying?
Well, let's just talk about all the weird random like stuff all the time. Like,
Oh, show up on a Friday. That's
Yeah,
what
you
that's
guys-
for.
Oh, yeah.
No,
why you shouldn't use tongue rings because it wears down the enamel on your teeth. Like, I mean, don't get eyebrow rings because most people don't know that your nerve, like your actual nerve is right there, and it's paralyzed. I mean, we could talk about all sorts of dumb stuff people do, not realizing it.
Jesus Christmas. I'm just
yeah.
telling you, there's just, America, that's,
I had somebody who they got like an eyebrow ring and it got infected. So they decided to squeeze the pus out and they squeezed their nerve out. And then they decided to keep pulling on it. And like, at what point, like I had a lot of electrical pain in my face. And I'm like, at what point in time were you going to stop that?
Well, as soon as the Molly wore off. I mean, dude, I don't know what the answer to that is.
Jesus Christmas.
I've seen the proof of concept in all of this. I've talked about this a little bit, but I did a couple of like piercing and tattoo shows in Colorado, 20 years ago or something like that, and we would have a couple of piercers come out to the campground at the Renaissance Festival, and you would completely sterilize a booth. You would go do the thing, but it was the aftercare that made the difference. And everybody in this campground had access to all of the exact same stuff. In fact, usually had all of the exact same stuff. And the people who took care of themselves had no problems. And the people who were lazy about cleaning shit out right after a piercing had problems. And you can get significant fallout from not taking care of a simple piercing, and depending on where it is, it could be a pretty significant problem. It really can.
All right. You got to have Nicole on Blunt Force.
We have one guy, he got, I think it's called the King Charles piercing that goes through the opening of the penis.
That's a Prince
and it
Edward.
healed, but it healed.
It's a what? Wait.
That's a Prince Edward.
That's it.
Or a Prince Albert. I'm sorry. That's a Prince
like
Albert.
That.
Can we get our princesses, our kings right, please?
Something like that.
Because when I go, I want to get the right procedure when I go. You guys are going to get me in trouble.
Yeah. Well, anyway, it goes through the orifice of the opening of the penis, and it healed together. So he had like 2 streams of pee coming out either side. And I'm like, we're going to have to send you to a surgeon to reconstruct that, right? They're probably going to chop off like...
Yeah.
Do you know what goes into that? Then you have to use a spacer.
Have you ever seen a dude with his dick split from by piercing?
Mm-hmm.
Yeah.
Okay, we're gonna wrap this conversation up right there because it's getting close to the end of the show. And I'm glad that when I go to the doctor, my problems are pasta. Can you cut it down on the carbs and the sugar? Nicole, tell everybody where they can find you and where we can get your work and continue to support you regardless of what the attacks that are going on you and what decisions and moves you have to make. I think it's terrible that you've been forced with a situation where people are sending you death threats. We all know what that's like on the show. It doesn't happen often to us, but we've had, people dox us, threaten us, whatnot. Mm-hmm. But you're in the heat of the battle right now because there seems to still be an argument going on. There still seems to be a debate. They're still trying to hold their narrative about this vaccine and about COVID. So I appreciate what you're doing, that you're under fire all the time. And I think we should start working on getting our friends to get together in Washington. We were at this anti-war rally. It was called Rage Against the War Machine. And one of the organizers from Defeat the Mandates was there. And he goes, how do we merge these two things together? Because it was 4 of us that were on the stage at the anti-war rally that were also on the stage Defeat the Mandates. So I think we should fire shit up for Seattle because there's a lot of war contractors there. This congressman, the congressman who writes the defense budget, pretty much, who's the main author of the defense budget. I believe his name is Adam Smith. I believe he's in Seattle. So there's a lot of work to be done. But let everybody know where they can go find frontline nurse herself, Nicole Sirotek.
So you can follow me on all the major social medias, Instagram, TikTok, Twitter, Facebook. Shots Heard keeps deplatforming me off of TikTok, but I'm there too. So just follow us there, and you can follow us on American Frontline Nurses on all the standard social medias and all the freedom-minded social medias as well.
Heck yeah. Thank you so much, Nicole. And please do come back. I want to have an extended conversation about medical oddities and some other weird shit. I really do. It's fun for me.
You should do that on Blunt Force. All right.
Well, come on
Steve has another show. Good.
Come on a Friday when Midnight Mike is here from the Our Big Dumb Mouth podcast, because Midnight Mike, if you're not familiar with Our Big Dumb Mouth, it's one of the funniest podcasts on the planet. They've been doing it for like 16 years. But Midnight Mike brings like all of the missing 411 stuff and a lot of the more like paranormal and somewhat just AI weirdness and things like that. And so we could roll all of this into that, and it would be wild. And I'm sure he would have some wonderful sound drops that would go along with everything that we're talking about.
Okay, sounds good. Thanks so much for having me on, guys. I appreciate it.
Heck yeah.
Love you,
Take care.
Nicole. Take care and keep yourself safe. God bless you and your family. All right, sweetheart. All right.